Hello, everyone. My name is Nina Kharka, and I'm going to be your moderator for today. Welcome to your community of practice of both the small and sick newborn. I'm sure all of you are very excited to join, and we are also excited to be in this conversation with you. I I was all the more, uh, you know, I'm just checking the chat box, and I can see people have joined from the Philippines, Brussels, Nepal, Senegal, Madagascar, France, Nigeria, Kenya, wow, Ecuador, um, Egypt, Uganda, London, Yemen, Nigeria, and of course the USA, Tanzania, yes, that's a lot. Thank you so for all your time and joining us for this discussion today. Um, we are going to start now immediately, and we think this is going to be a really exciting discussion, primarily because we are going to hear a lot from you. So for today, we are looking forward to hearing from what you have to say, your ideas and thoughts for it. Next slide, please. So just as a quick recap, so our first webinar of this community of practice took place on June 24, and we had overwhelming respondents and participants even at that time, telling us that this is a very important topic and very close to many of our hearts. And at that time, the topic we had discussed was on family-centered care to improve newborn survival and developmental outcomes. We had this planned in a way that it followed the release of Chapter 4 for the Survive, Thrive, and Transform report released by WHO, UNICEF, and USAID. And Chapter 4 was focused on ensure they thrive. And the intent of that webinar was to go deeper dive into how family-centered care was the approach that would help us ensure that newborns thrive. We had three esteemed panelists, Selena, Arti, and Linda. And Selena presented a very touching story about her boy, her young son, who is right now 5 years old. And he was born, and King Arthur, that's his name, lovely name. And he was born at 31 weeks in Ghana, and he was just about 1.4 kg. And she shared her turmoil in having a small baby who was put into a NICU immediately, and the separation was torturous, and the stress was very high. And the one thing she said was so touching. She said the magical moment for her was when the baby was given to her to be put on skin to skin for to start of kangaroo mother care. And that was what touched us most, the stress she felt and the moment of magic that she felt when she had a baby. And because of all of the care and love that she was able to provide with the support of health providers, King Arthur is now 5 years, very healthy, well developed child. And then Dr. Linda Frank actually set the stage for us in terms of what what is the evidence around family-centered care, and was able to note that family-centered care can actually transform care for small and sick newborns. And she shared a few evidence on how family-centered care led to improved survival, but also improved outcomes for babies because they were thriving more. So babies who were assessed at 18 months following family-centered care in the newborn unit were doing better and were doing much better in neurodevelopment. So that was so inspiring. And finally, I'd like to remark Dr. Arti Maria from India shared her story about India's story on family-centered care, the struggle they had to go through to initiate family-centered care, which was started as a need in the facility, in the public health hospital. It's a huge hospital, but really crowded, and it's amazing the work she's done out there. But it was followed by, it wasn't limited just to her. There were challenges and the hospital itself, but India took the learning from that hospital and has now scaled it up and is supported by the government of India, and it's moving forward. Next slide, please. So Today, so to build on that webinar itself, today we are focusing on bringing all of us together. So the challenges are there. The challenges of implementing family-centered care is not easy. And we've just picked up around 3 topics today, the 3 themes, because we wanted us to really go deeper dive and talk about it and bring experts like you who have experience from country levels of trying to implement some elements of it, and to get you to work with us to think through what are the solutions that can be brought together for us. And so hence today our primary objective was to bring you all together, experts and practitioners from across countries, to discuss challenges on the selected themes for implementing family-centered care, so that you are able to share your experience around the challenges, but also discuss pragmatic solutions, actions that countries and all of us can take during this current scenario, but also in the longer term. Next, please. So the themes we have picked up this time around, and we are hoping that the next time around you will be picking up the themes for us and telling us how we can support you. So the first theme is on partnership between providers and families for inpatient care of small and sick newborns, the acceptance and the motivation. As you heard in the webinar earlier, or even if you missed it, but one of the primary barrier can be the motivation and acceptance, both on the side of the provider but also on the side of the family and the parents. So how do we overcome that? What are the issues that providers feel, the discomfort or the comfort to having parents join hands with them in the newborn unit and to take care of the newborns? The second is infection prevention within, and so sorry about that. The facilitators for that is Natalie Charpak and Goldie Mazia, our expert facilitators who will gently steer you through the conversations. The second theme is infection prevention with the sick newborn units. So one of the issues identified for allowing parents to enter newborn units is that they could be the cause of infection. And it's been shown that they are probably aren't the cause of infection. There are other issues that actually cause infections in sick newborn units, and we want you to discuss under the able facilitation of Dr. Robert Drybelbis and Steve Sarah today in your team, and come up with solutions. And finally, the third most important group is the conducive infrastructures and commodities for provision of family-centered care, facilitated by Dr. Queen Dubé and Steve Wall. And this is, again, a very basic need. If you want to have family-centered care, then the newborn unit structure and commodities, and even the hospital structures that are supportive for the mother and the family to stay back long duration has to be discussed. So these are our 3 themes for today. Next slide, please. So just briefly as to what's going to happen next. So you're going to go into your breakout room. So one thing that I've been asked to share is that because we had such an overwhelming registration number, probably you might face some difficulty in entering your rooms. Please be patient. Don't worry about it. The organizers are working behind the scene to ensure that you get into your room of choice. So give it some time. But even for those who are entering, you'll have to wait a little bit. So just click as soon as the link comes on your screen. But and also, if you actually face any problem, send a note to the host or any one of us, and we will take care of it. So that's the first part. So once you enter your breakout room, the facilitators will briefly introduce the theme and then share what is the expected deliverables from the group work and support your conversations. So please feel free to talk. And just in case there are too many people talking and you are not getting a chance, just start chatting in your chat box. The facilitators will be monitoring it and ensuring that your inputs are captured. Notes will be taken from this discussion and will have to be summarized for presentation in the plenary. Hence, the request is that once you get into your groups, please select a rapporteur who will be presenting back, and we will be requesting you to present back within 3 to 4 minutes so that we leave around a few more minutes in the end for people to ask questions related to other themes. There will be a note taker who will be helping you with the notes and also to draft the slide for the rapporteur to present. And one final point before you come back to the plenary, as you come back to the plenary, there's going to be a poll that will be asking you questions uh, to respond to. Now, this poll is actually to get your inputs into how you want to shape this platform, which we consider is yours, actually. And so your inputs will help us to improve it and meet your needs so that you use this platform to be able to improve the care of small sick newborns in the future. I think that's the last one. Next, let's see. Is that so? Yeah. Okay. No, no, don't go away. It's not a goodbye. So over. Let's move to our breakout rooms.